Next, I would like to present CHAIN, which is a Center for Global Health Inequalities, which is led by Tarja Aikemo at the Department of Sociology. And I would like to draw on experiences in CHAIN in collecting, harmonizing, and analyzing comparative data on health and well-being across countries. CHAIN's aim is to monitor, explain, and reduce social inequalities in health, and CHAIN's vision is to promote health equity through research excellence. In CHAIN, we believe that all people have the same right to good health, and it's a matter of social justice. So CHAIN works to create a global transformation of actionable health research by bringing together scholars and international organizations such as UNICEF, WHO, with a common to better determine how we can target water resources to reduce health inequalities. We see that there's been a large decrease in child mortality in the recent 20 years compared to the period before, but we still observe a pattern of social inequalities where children with low educated mothers or with mothers with no education experience higher levels of child mortality. So to briefly sum up all of the CHAIN activities and the pillars, CHAIN aims to monitor international variation in health inequalities between and within countries. CHAIN also aims to explain health inequalities within countries. And finally, CHAIN aims to identify policies and interventions that could reduce health inequalities. This can be done by, for example, reviewing past interventions through systematic reviews and evaluation studies. CHAIN cooperates with international organizations, public and private sector. And what is common for all these three pillars is that it's a large geographical coverage, both on the global north and global south, in terms of the data which is being collected. And CHAIN also promotes to focus already on childhood and in a life course perspective. And finally, also to focus on intersectionality. Here are a few examples of what CHAIN undertakes within each of these pillars. It also highlights some of the partners of CHAIN, most notably UNICEF, WHO, and the European Commission. For example, within the monitoring pillar, CHAIN works together with the Global Burden of Disease Study, or the GBD study, which is based at the University of Washington. And CHAIN has also developed two rotating models on the social determinants of health as part of the European Social Survey. CHAIN also hosts the largest comparative data source on education and score-specific mortality in Europe. And this data from monitoring then tap into work on explaining the inequalities. For example, CHAIN leads the work of the WHO Technical Advisory Group, which works on the importance of social conditions for COVID mortality. And an example of the reducing pillar that Tarja wanted me to mention is the microsimulation, which proved to be a flexible tool to evaluate policies and their impact on health inequalities. This is a recent paper from last week. CHAIN also cooperates with Innocenti. Indeed, CHAIN visited Innocenti in May last year. And this picture is from a network meeting hosted by Walter Rees here. And one example of the cooperation is the Innocenti's report card series, which CHAIN has been involved in as well. So in addition to describing and explaining the inequalities, for example, in mortality in Norway, such as in this example of the paper, CHAIN also works and underscores the importance of cross-national studies, which are important. And here we can better understand social inequalities in women's health as they manifest differently in different European welfare regimes. And guide with new data on children development could really add to better understand how these inequalities already form in early life. This is another theoretical understanding of the complex interplay of socioeconomic and contextual factors in health. And in this model, which is developed together with Tess, Chain, and Promenta in Oslo, there are two guiding principles that we need to look at the developmental and interactionist perspective. So tracking the development from birth to adulthood across generations and in family and societies. And second, health inequalities are also shaped through complex interplay of factors at different levels.